Good afternoon, everyone. Welcome to UCSF Family and Community Medicine Grand Rounds. Our speaker today is Dr. Seth Berkowitz, who will be talking about the fundamental importance of social insurance for health equity. Appreciate all of you joining us today. Just a few reminders, as always, today's session is recorded. If you want to go back and rewatch this session or any other session from UCSF Family Medicine Grand Rounds, as always, you can find us on the UCSF website. Um, we're hoping that today's session will be an exciting and engaging one. So please use the Q&A box to share your thoughts, questions that we will be able to engage with Dr. Berkowitz about at the end of the session. And also there's a feedback session evaluation, which Roy will put um, in the Q&A session or in the chat later. And if you have suggestions for today's speaker or for other speakers, please feel free to use that. We're always excited to hear your feedback. I want to thank our tech team today, including Roy Johnston and Erica Mitchell. Much appreciate your help as always. And last but not least, one other announcement before we get started, which is if you like Grand Rounds, come and join us for a full day of family medicine education at the UCSF Family Medicine Annual Rodnick Colloquium on Thursday, May 22nd. There'll be invitations going out soon, but if you sign up in advance for it, you can have lunch while you're there, which is a good thing. So please join us. The Today's speaker, as I mentioned, is Dr. Seth Berkowitz, and he will be talking about the fundamental importance of social insurance for health equity. Today's talk will draw from the recent book, Equal Care: Health Equity, Social Democracy, and Egalitarian State. It will describe the relationship of income distribution to health outcomes and discuss how to design, implement, and finance income support policy that can improve population health and health equity. Our speaker, Dr. Seth Berkowitz, is an associate professor of medicine and section chief for research at the University of North Carolina, Chapel Hill School of Medicine in the Division of General Medicine and Clinical Epidemiology. He's a general internist and a primary care doctor. He completed the UCSF primary care medicine what a day. He's completed the UCSF primary care internal medicine track here at UCSF for his residency. And he studies the relationship between health-related social needs, such as food insecurity, and health outcomes. Um, Dr. Berkowitz, as I've mentioned before, is an author of the recent book, Equal Care: Health Equity, Social Democracy, and the Egalitarian State, which is a book in examining how public health can improve and public policy can improve the health of populations. Please join me in welcoming Dr. Berkowitz. Thank you.
Thanks so much, y'all. Kind introduction and yep, where did my slides go? Okay. Um, and as mentioned, I was a UCSF resident in the primary care internal medicine track and have fond memories of working with family medicine co-residents in the old 5R in the old hospital back when I was in residency. So it's great to be speaking with you all today. Um, just in terms of disclosures to get started, I have received research funding from listed institutes generally on health-related social needs topics, and then also personal fees for research and evaluation consulting for on sort of the same topics from the organizations listed here. And I at least theoretically may receive a royalty from book sales at some point. Hasn't happened yet, but hope springs eternal. So need to mention that. Um, as mentioned, this is sort of a one topic within this book. And I'm not going to try to go through the whole book in the brief period of time because that would be, I think, just painful and not very helpful. So I'm going to pull this out, but if there is, things in this approach that seem interesting to you, there is a lot more in the book, and so maybe useful. And overall, I sort of view the book as a framework for understanding how social conditions affect health and how to use social policy to improve population health. It very much came out of my work as a primary care doctor. Sort of seeing the health consequences of policy failures in clinic, but not feeling like I had a good handle on the bigger picture of what specifically is sort of creating these and what we might be able to do differently in order to improve population health. And so anyway, came out of that experience. I feel like many folks here maybe in the same boat. And so if you're interested in these ideas overall, you might like the book. I saw the UCSF library does have it as well, so you can read for free. So these are the topics that I want to try to cover in the talk today, and we'll just kind of move through these things. So I'm going to start out very briefly, just sort of talking about the general relationship between income and health. I doubt I have to convince anyone on in this talk that this relationship exists, but I think the way that we think about it can be helpful for understanding sort of where to go next. So I wanted to start there. And so fundamentally, as sort of a shorthand, I think of health as being sort of an integral of lifetime social conditions. So it sort of, sums up or takes the area under the curve of all the social conditions that someone has experienced throughout their life course, and that, kind of leads to the current health state that someone is in. Epidemiologist Nancy Krieger from Harvard calls this an emergent embodied phenotype. It's a physical manifestation of the material conditions someone has experienced across their life course. And so to have those conditions be more salubrious, more health promoting, one thing that people in general need is something that you might call consumption power, the capability to consume certain goods and services, products produced by other people that are necessary for health. So this would include things like nutritious food, high quality housing, medical care. And so over the course of your life, you need to be able to consume these things in order to have good health. Um, and so some of these products are allocated what you might call administratively. For example, primary education in the U.S. Is allocated administratively. The person receiving the education is not buying that on the market for the most part. At least they don't have to do that. That doesn't mean that money and financing isn't involved, but essentially, if you're of the right age and live in the right geography, you get to go to public school. And so that's an administrative allocation of the capability to consume, educational services, an economist might say. But a lot of products are not allocated administratively; they're allocated through market mechanisms. So you buy them, and so income is what provides the purchasing power that in turn yields the consumption power for the products that you need. And so for those products that we've kind of chosen in the U.S. to allocate via markets, if you don't have income, then you don't have purchasing power, and then you don't have consumption power, and so you're likely to come to harm. So if you're not able to afford healthy food or high quality housing, things that are mostly allocated by markets in the U.S., then you may have problems. Medical care, similarly in the U.S., although there's some quasi administrative allocation in some situations. Um, so that's kind of the general idea. And I saw Dr. Braven's on the call, but in the social determinants of health literature, you might talk about how that relates to the sort of neo-materialist idea of the relationship between social determinants and health. You have to have the right stuff, physical things and resources in order to be healthy. Income also affects social status, however, and thus how individuals relate to each other, and that has important consequences as well through various psychosocial pathways. And so overall income distribution has a strong relationship to overall health through at least these sort of materialist and psychosocial pathways. And so fundamentally, you can kind of think of income as creating what you might call the vital conditions, the conditions that people need to be healthy. And so a key population health goal then is to make sure that everybody has an income. Because again, if you're going to allocate goods and services needed for health through market mechanisms, then people need an income to have purchasing power and thus consumption power for those goods and services. So that's kind of the big picture relationship between these things. Oop, moving backwards. All right. So with that as just sort of a general overview, and I'm sure this was sort of common knowledge to folks already. I want to talk about then how you might actually distribute income. So, again, the question here is if we need to get an income to everyone for population health reasons to give them the consumption power that they need, how do we actually do this? How do we distribute income to do this? And so in thinking about this, it's worth sort of subdividing income into two types. And these come from the economics literature. This is sort of not, my coinage or anything like that. But you can think of one type of income as being what's called factor income. So this is income that is distributed for supplying quote unquote land, labor, or capital, the factors of the economic production function. So if you work for wages, or if you rent land that you own, or if you receive, a dividend or a profit for capital ownership, then you're receiving factor income. And what happens here is that, you and other people come together as sort of a joint venture for production. You make some stuff or provide some services. You sell that on the market, and then the proceeds get distributed to the people who supplied the various inputs to that kind of thing. So the factor income. Um, the other type of income is what's called transfer income, and so this is income that's distributed without the exchange of goods and services. So it's not related to economic production. It's distributed in some other, at least it's not related to your participation in in economic production. It's distributed in some other way. Um, and so of these two types of income, they can basically be distributed in three main ways. There's one distributive institution that handles factor income, and there are two that handle transfer income. So factor income is generally distributed by what you might call the factor payment system, and these are sort of the sets of rules and regulations and policies and norms and informal agreement that have to deal with how income that results from supplying factors of production get distributed to people. So wage regulations, union policy that affects employment contracts, financial and tax policy. All these things are sort of part and parcel of how this income gets distributed. For transfer income, the first distributive institution or sort of pattern and practice of how income gets distributed is what you might call family transfers. So people often aggregate into households or families that pool resources, and within these households, resources gets transferred. So I have two young children. They don't work. My wife and I work, and so their income is transferred within our family to them, and that's where their sort of food and housing services and other things come from. And this is obviously sort of common, what people do across the world and throughout history. Of course, it's worth noting that single person households are common, and I'm not trying to be normative and say that, people should be in multi-person households or anything like that, but this is just a common way that many people get income. The other distributive institution that handles transfer income is what you might call state transfer. So these are things like income support programs, Social Security checks, SNAP, WIC, these kind of programs that provide income for people through a governmental program. Um, so one question might be, well, why do we need to have transfer income? Why can't the factor payment system handle this? That's where all the income in the U.S. is produced. It's produced through economic activity. So why can't it just be distributed based on how people relate to that system? They either supply labor, or they supply land, or they supply capital. Why can't all of our national income be distributed through the factor payment system? And I mean, in many ways, I think this is sort of the default sort of folk explanation, right? If someone's income is too low, they should go out and get a job. And even, from and you might say that that's sort of a conservative viewpoint, but even from the left or something like that, people may emphasize, well, we need to have good paying jobs, we need to have a living wage, and those kind of things, which are all ways to distribute this. And I'm not disagreeing with that, but there's sort of a fundamental structural problem with relying on the factor payment system, and this is that about half of people in the U.S. don't work. And they don't work not because everyone's lazy or because people don't want to work anymore, although you might hear that in the media. They don't work for sort of good life course reasons that are essentially unavoidable. And these patterns I'm going to talk about as occurring in the US are very similar in most other countries that are similar to the US around the world, have been very stable over time, and are just sort of like facts of the human life course that you sort of have to build your policy around. So first, about 40% of the population in the US, and I'm using numbers from 2019 that I chose just to be before COVID, but I've actually looked at the numbers in 2023 and 2024 using census data recently, and they're essentially exactly the same, like to a percentage point. So there are no real differences there. But about 40% of people in the US are children age under age 18, or older adults, age 65 and older. And so these are populations that, not historically and for all times, but in general, we think probably don't have primary responsibility for going out and working as a way to earn income. And fundamentally, even if you sort of, argue about what the age cutoffs would be, there's going to be some age where you're just too young to work, and there's going to be some age where the vast majority of people reaching that age are just sort of not really able to work to earn a living. So that's 40% of the population right off the bat. And then another 10% of the population are in what you might call working age 18 to 65, but have a work limiting disability, are currently full-time students, so planning to work, but they're receiving advanced training prior to entering the workforce, or maybe not prior to, but in lieu of in the workforce at the time. They're doing socially necessary but unpaid caregiving, like raising children or caring for sick loved ones, or they're unemployed and actively looking for work, so they're just sort of between jobs at the moment, and so would like to be working, but are there's just sort of a matching issue there. So that means only about 50% of the U.S. population is really engaging in paid labor at any given point in time. And then further, because ownership of land and capital assets is very unevenly distributed in the U.S., very few people own enough of those assets that they receive enough income to live on in the absence of supplying paid labor. So fundamentally, there is just a big portion of the U.S. population that is not receiving income from paid labor. And again, for sort of structural reasons about the human life course that there's really just not much you can do about. You can maybe shift a little bit of employment on the margins or something like that, but fundamentally, if 40 or 45 or 50% of the population is just not going to be engaging in paid labor, then you're going to need to account for that in your public policy. And so this is just sort of another way to illustrate the same point. So this is the personal earnings percentile in the US, and this uses 2023 data. So this is how much each individual in the US earned binned into 100 different groups, so a percentile. And what you can see is that, zero is the earnings for, right up to about the 50th percentile. So again, about half of people in the US have zero personal earnings in any given year. They're not engaging in paid labor. And so your policy needs to take account of that. And the factor payment system, since it only deals with distributing income for people involved in economic production, can't be your only way to do this. So fundamentally, you have to have mechanisms of transfer income distribution to complement the factor payment system, or there's just going to be a lot of people going without income. Now, family transfers can make up for that in a lot of cases, right? So parents providing for their children is sort of very common, and that does work in a lot of cases, but it doesn't work in all cases, and that's why we see high rates of poverty amongst children. That's why we until the advent of things like Social Security, saw high rates of poverty amongst older adults, and there still is some poverty, but it's just lower than it used to be. So fundamentally, you need some sort of set of income support policies, which is sometimes called the welfare state. I use the term the welfare state positively, but a lot of people sort of use it pejoratively, at least in the last a couple decades or so. But you need some set of income support policies to complement the factor payment system, or you're just not going to be able to get income to people who need it, and that's going to have negative health consequences. And the picture is sort of a landmark book in sort of social policy studies that talk about different formulations of the welfare state across different countries like the U.S. and the Nordic countries and Central Europe and those kinds of things. Um, Okay, so that's the reason, that's the reason why and sort of how you might do income support. Um, I guess sorry, I should say it's the reason why, but then the question is, all right, well, how do you do this? What are the approaches to income support that we might use? And so fundamentally, there are kind of three main approaches to income support, what I'll call social assistance, social insurance, and guaranteed income. And so social assistance is a family of or an approach to income support that conditions providing that income support on the basis of need. So it looks for people who don't have sufficient income, they're in need of more income, and then tries to provide income to people in those situations. This means that there are often what are called means tests to these programs. So if your income and assets are below a certain level, you're eligible, and if they're above a certain level, you're not eligible. And it also means that there are often things called phase outs, meaning that the amount of support provided reduces as your income increases. So if you have zero income, you might get a maximal benefit amount. If your income gets close to the threshold, your amount of support goes down, and then above a threshold, it goes to zero. You don't have to have phase outs. If you don't have that, that's something that's called an income cliff, or a benefit cliff. So benefits can go from a maximal level to zero if you cross some threshold. In general, you don't like to do that as a matter of policy design, but it does sometimes happen. Probably the clearest example in the U.S. where that happens, although you could argue about whether this is a method of income support or something else, but Medicaid. So if you're like $1 above the Medicaid limit, you just don't get Medicaid, and if you're $1 below, you do qualify. So that's a benefit cliff. But something like SNAP or SNAP, probably everyone knows SNAP, but SNAP, the Supplemental Nutrition Assistance Program, formerly the Food Stamp Program, or TAMP, Temporary Aid to Needy Families, or WIC, the Special Supplemental Program, Nutrition Program for Women's Infants and Children. These have phase outs incorporated into them, along with a means test that determines eligibility overall. So that's the social assistance approach to income support. And in the U.S., that's kind of a predominant, although not the only approach. And it may even be, what comes to mind when people think of income support in general is income support using the social assistance approach. But it's not the only approach, and some of the other approaches are important to know about as well. So the next approach I want to talk about is what I'll call social insurance. So social insurance conditions support on risk of insufficient income related to having what you might call a covered reason for not engaging in paid labor. So what do I mean by that? I mean that there are certain situations where we just sort of recognize as a society that people are unlikely to be able to support themselves through engaging in paid labor. And in fact, we might even take a normative stance and say people shouldn't be engaging in paid labor, even if they should. We have child labor laws for exactly this reason. It might be physically capable for, a Dickensian street urchin to be a chimney sweep and support themselves that way. But we think that's bad, and we don't want that to happen. And so we put laws in place to stop it. Social insurance, looks at people in these situations where they have risk of insufficient income. Doesn't mean that everybody in these situations would have insufficient income in the absence of these programs. Some people may have savings or family transfers or other things like that to support them, but the risk is high. And it says, all right, this is a risky situation. We need to provide people with some income support when they're in these situations. And these kind of follow those same roles that I talked about before as the reasons that people might not engage in paid labor. And so child allowances are a type of social insurance. We sort of, famously had a much better version of a child allowance as part of the 2021 expanded child tax credit. And then we somewhat infamously let it revert to a much worse version of a child allowance. Most other countries have child allowances that are similar to what we had during the period that the 2021 expanded child tax credit was active. Another type of social insurance program is older age pensions in the U.S. The main one is called OASI, Old Age and Survivors Insurance from the Social Security Administration. If you think of a Social Security check that people get, this is the OASI program. We have disability income programs. So in the US, a major one is SSDI, Social Security Disability Income. That's for people who had qualifying working quarters. There's also SSI, Supplemental Security Income, which serves as disability income for people who wouldn't have qualified for SSDI in most cases. There's unemployment insurance. And then there are things like paid family leave or parental leave for the caregiver situation and that kind of thing. So there are social insurance programs that are you're eligible for on the basis of being in a particular situation that carries high risk of having insufficient income because you're not earning factor income in that situation for the most part, and most people aren't. And one way you can think about what social insurance is doing is that it's sort of, taking the earnings that you might accumulate over your entire working career and spreading them out to situations when you wouldn't be able to access those earnings. So your childhood, maybe before you even earned it, this is, sort of a conceptual, theoretical thing. No time machines are involved. It's not actually your specific earnings, but as a system, we do this, or in older age, a pension or unemployment insurance. And so you can kind of spread the earnings across your life course in order to ensure against the risk of having insufficient income at any one particular time in your life. So that's the social insurance approach. And then finally, and this is an approach that there's been more interest in recently, although it's yet to see much large scale adoption, is something that you might call guaranteed income. So, guaranteed income conditions income support on population membership alone. So, it's not based on need, it's not means tested, it's not based on risk, it's not based on being in a sort of covered social insurance category. It's just based on being part of the particular jurisdiction that the program is operating in. And then, as a subtype of guaranteed income, you might talk about universal basic income, with the idea being that a universal basic income is a guaranteed income where the amount is sufficient to live off it alone. So you don't necessarily need other programs in addition to it. So guaranteed income might be of any amount. It could be $1 a year, and that might be guaranteed income as long as it's income that goes to everybody. But that's not going to do very much for you. Universal basic income is an amount that's sort of sufficient to live off of. And in general, this tends to be set at something like a single person poverty threshold, which in the US currently is around $1,000 a month. It's a little bit more now, but that's sort of been a round number that people often use for UBI programs and things like that. There aren't a lot of examples of true UBIs anywhere in the world, as far as I know. There are examples of guaranteed income programs, so income distribution that goes based on population membership, but is not conditioned on other factors. So in the U.S., the Alaska Permanent Fund dividend, which is paid each spring to every resident in Alaska, is an example of a guaranteed income program. The amounts, though, are below what you might consider a UBI. So although it fluctuates from year to year, the amounts are generally on the order of $1,000 to $2,000 per year. So certainly not enough to live on by itself, but it is a functioning guaranteed income program in the U.S. that was passed under a conservative or at least a Republican legislature and has been operating for like 40 years at this point. So there are some examples, but they're not as common as the other two. Social assistance and social insurance are much more common both in the U.S. and worldwide. All right, so these are sort of the overall ways you can do income support, and I just want to kind of reiterate what some of the key social insurance programs are, because I think a lot of the problems that we have with income distribution in the U.S. Relate to relative weakness in our versions of these programs, and in some cases, complete absence of these programs compared with other countries. So again, we're thinking of social insurance as being ways to provide income support for people in situations where you're not likely to earn income from wages, and for sort of life course and other structural reasons. And so you need some form of income support to get people the income they need. Probably the primary form of social insurance around the world, one of the largest line items in the budget of almost any OECD country, is social insurance programs for people in older age, variously called pensions, or in the U.S. Social Security checks and these kinds of things. These have been enormously successful. It used to be before the advent of these programs, people would essentially try to work until they died. Retirement was really not feasible for most people. Rates of poverty amongst older adults were some of the highest of any segment of the population. Had major health consequences, and a lot of that has been effectively eliminated in many countries. Not that poverty doesn't exist amongst older adults, but it's relatively low compared with other populations population segments, and in particular, given the amount of workforce participation in this population. So these programs have been very effective and have had very important health benefits. In the U.S., we skew our older age programs too much towards private benefits that mostly go to people who are higher paid during their working career. So there is OASI as an effectively public pension that more or less covers almost all older adults. There are some people who don't quite qualify, but it's something like 95% or more of people age 65 and older, or 62 or older in the U.S. Either are or will qualify for OASI. However, we also put a lot of money into tax advantaged retirement of plans like 401ks, 403bs, academic annuities, and these kinds of things. And that almost all goes to people who had higher earnings during their working career. And so overall, we probably have more poverty amongst older adults in the U.S. than we would if we sort of rebalanced the amount we spend within this category towards more public insurance provision and put less of our money into tax expenditures on, letting your, tax advantaged savings accounts and those kinds of things. So overall, U.S. older age pensions are one of our better examples of functioning systems, but there is still a little bit of room for improvement. The next area is child benefits, and this is an area that the U.S. is especially weak on. We currently have sort of two main child benefits that a lot of households qualify for. These are the earned income tax credit and the child tax credit. Both of those are structured very similarly, so you have to have some amount of earnings um, to claim the benefit at all. So for people with zero income, you do not get the benefit. And then the amount of benefit increases for a period, then it plateaus, then it decreases and phases out entirely. So it forms sort of a trapezoidal shape. Um, and so the EITC and the CTC, the child tax credit, both provide particular benefits for households with children. Child tax credit only for households with children. EITC does have a small benefit for households without children, but the bulk of the money comes for the increases based on the number of children in the household. You get more for one, more for two, more for three, and then there's no more beyond three. But the difference between a three child household EITC and a zero child household EITC is pretty substantial. Like, I think 75-ish or maybe 80% of the total benefit is based on the children in the household. Um, so this works okay. It's better than nothing. And there are some studies showing benefits from health benefits from the EITC, and then there's sort of a burgeoning cottage industry of literature on benefits from the 2021 expanded child tax credit. But it fundamentally excludes households with zero income, so providing the least support to the poorest households. Generally, not a good way to improve population health. And so there are just kind of major holes in the way we do this in the U.S. Disability income, this is another area where we have disability income programs, but as I'm sure many people on this call know, it's extremely difficult for people to access. There are very long waiting periods. Benefit amounts are often insufficient. And so there's a lot of improvement that could be done for disability income programs in the U.S. SSI and SSDI are sort of the two main public disability programs in the U.S. Workers' compensation also plays that role to some extent, but dollar-wise, much less than SSDI and SSI. SSI in particular has an extremely low benefit level and extremely restrictive asset requirements, such that it's difficult for it to really provide much meaningful support for people. And so it creates a lot of issues. Unemployment insurance, this is another area where the U.S. is relatively weak compared to the rest of the world. We do have unemployment insurance in all 50 states. It's federally mandated that a state provides it, but there's a lot of state-to-state variability in how it's actually operated. Compared to other places around the world, a smaller percentage of workers are covered by unemployment insurance in the U.S. based on how the laws are structured. The what's called the replacement rate, the sort of percentage of your income that's replaced if you lose your job, is relatively low in the U.S. and the duration of benefits is very short in the U.S. except during periods of recession when it generally gets temporarily extended by acts of Congress. But overall, the duration is quite short, sometimes as short short as 12 weeks, which and actually I think some states are maybe even shorter than that, eight weeks, which is very short by worldwide standards. Most other places will have benefit durations around 26 or even 52 weeks. So short duration there. The next area is when people are pursuing advanced education. So we do have some programs here. Things like Pell Grants are one example of how that's done. But a lot of the sort of financing for living expenses when people are pursuing advanced education is either meant to come from people's families or meant to be done as loans taken out by people, part of student loans. And this obviously doesn't work well for people who don't have families with a lot of income to provide and or who don't want to take on a huge amount of debt that they may not be able to repay based on the education received over the next 30 or 40 years or so. And that's why we've sort of come to what you might call a student debt crisis in the U.S., where people have balances of debt where the earnings that they're getting from their jobs are just not really able to touch the principal on that, and so just remain in debt for really long periods of time. And then finally, an area where we're extremely weak is caregiving benefits. So there's no nationally mandated paid leave program. There's FMLA, which is job protection. So it allows people to take leave without losing their job in certain circumstances, although it doesn't cover all jobs, but it also doesn't provide any financial benefits during that time. It just says people have their job to come back to. Some states have paid leave programs, and many organizations offer it as sort of what you might call an enterprise benefit, but it becomes this sort of patchwork and it's ad hoc, and it's often the case that people who are in better paying jobs are the ones who have these benefits, and so that has population health implications as well. And that's just for what you might call short-term caregiving. We really don't have any provision whatsoever for longer-term caregiving. So if people are a stay-at-home parent or something like that, there's really no income support that we're providing for them, even though being a stay-at-home parent essentially precludes engaging in full-time factor income earning through paid labor. But kids need care, and caring for kids is work, and so it needs to be done as part of social reproduction. But we just don't have programs to support people adequately, whereas many other countries do, or at least do it better. All right, the last sort of topic. I know we're moving in time, and I know people probably have afternoon clinic that they need to get to. The last question, sort of set of topics, has to do with, well, why might you prefer social insurance over these other approaches that I mentioned, social assistance or guaranteed income? So I'm going to start by comparing with social assistance, and I want to be very clear that social assistance is much better than nothing. So I myself do a good amount of research on SNAP and other social assistance programs. They definitely produce benefits. If we didn't have them, it would be very bad. I would be very much against cutting SNAP, as seems like there's going to be a confrontation over in the upcoming legislative session, or the reconciliation bill in March. So it's good that we have these programs overall, but the mechanism of providing income support through social assistance as compared with providing it through social insurance, I think leaves something to be desired. And so there are a couple problems that essentially have just proven intractable in social assistance programs. These occur in the US, they occur around the world. It's not just an issue of political ideology. It just seems to be difficult to design social assistance programs to not run into these problems. One of them is that because they're means tested, because you need to establish that you're eligible for these benefits, and in particular that income is one of the key eligibility criteria. There's this sort of adversarial dynamic and a relatively burdensome process necessary to do so, and that lessens uptake. So for SNAP, only about 80% of people who are eligible for SNAP actually receive their benefits, or about 1 in 5 do not. To put it a different way, for WIC, because that's even actually more administratively burdensome because it involves interaction with the healthcare system, only about 50% of people who are eligible for WIC actually receive their benefits. And so these administrative burdens just make it really difficult to actually get benefits out to people who are eligible for them. And so that winds up being a real issue. And then also, because you're constantly having to prove your income, there's this adversarial dynamic. Are you overstating it? People are always on guard for fraud and other things like that. And so it just becomes this, sort of bad and unpleasant and sort of stigmatized experience to try to claim these benefits. And that also probably reduces uptake and is just just, sort of soul crushing. It's not treating people with respect in terms of them getting their benefits. Think about how signing up for Medicaid goes compared with signing up for Medicare, for example. This leads to low take-up issues, which I mentioned. It also, the phase outs that are part of these programs leads to something that are called high effective marginal tax rates or sometimes poverty traps. So the idea here is that because your benefits are reduced as your income increases, it makes it harder to get ahead. So with SNAP, for example, for every dollar your income increases, you lose about 25 cents of SNAP benefits up to the threshold. And so you can essentially think of this as a tax on the total amount of resources that you have, right? If you gain an extra dollar from work income, you lose 25 cents of SNAP benefit. And so the total resources that your family has to spend on food go down by about 25%. And that functions exactly like a tax. Now you might hear 25% and say, yeah, that seems like a reasonable tax rate, but that's an extremely high marginal tax rate for the income levels that people receiving SNAP have. So at the income levels that people who are on SNAP, who are eligible for SNAP, have, most people will have actually a 0% tax rate. They're excluded from federal taxes, or at most maybe a 10% tax rate on that income. A 25% marginal rate isn't hit until a single person has an income of around $100,000 a year, which is much lower than people on SNAP have. And so taxing SNAP benefits at 25% is actually a very high marginal tax rate for that income level. And so this creates that kind of poverty trap scenario of, two steps forward, one step back, and contributes to these programs not working as well as they could. Although again, SNAP is a very good program. It's important to have. I'm not against it. And then finally, I think it also is just been empirically difficult to generate support for sufficient benefits because social assistance programs are framed as issues of assistance. They're framed as how much should we, quote unquote, the taxpayers be providing to people who aren't paying taxes. It creates this sort of us versus them dynamic. And people don't see themselves as being likely, people don't see themselves as simultaneously being taxpayers and likely SNAP users, for example. And so the benefit levels just tend to be insufficient. And so around the world, you just see relatively small benefit levels for social assistance programs, and that makes them less effective at, actually supporting people's consumption power than they might otherwise be. So fundamentally, it is important to have social assistance programs. They're a very good backup plan if something sort of falls through the cracks, but they probably shouldn't be the main approach to doing income support. And this point sort of gets into the questions of what you might call universalism versus residualism. So universalism and residualism are sort of conceptual orientations towards the ways that you provide income support. So the idea of universalism is to create first line programs that are essentially meant for everybody within a given category. So in the US, examples of universalist programs might be Medicare or Social Security OSAI, where again, the idea is that, everyone within the category for which they're designed gets to use them. So for Medicare, all older adults, rich or poor, whatever, are eligible for Medicare once they turn 65. Similarly, Social Security checks, although they vary, the amount will vary by the income that people earn. Their Social Security checks for everybody. It's sort of a first line program. Everybody gets to use it. Residualism is the sort of safety net idea that, you should only be using these programs if everything else has failed. If you have needs that are left over or residual, which is where the name comes from, when you've tried to sort it out on your own or turn to your family or charity or other things, then the state might step in and try to help you out. And so these programs are only meant as a safety net. They're only to be used for a short period of time when absolutely necessary. And examples of residualist programs in the US are things like SNAP or TAMP or EITC. And so these are just two different conceptual orientations to providing income support. And again, providing income support is good, but if you were to rank it, not providing income support at all, that's the worst. Residualism tends to be, sort of in the middle, and then universalism as the approach tends to do a little bit better. And that's because it essentially puts a lot fewer burden on participants, because eligibility is much simpler. it's not as burdensome. Medicare, for example, although there's the open enrollment every year, it's a much different process than the certification and eligibility process for Medicaid. To compare and contrast a little bit, it tends to have less administrative overhead because actually administering the eligibility testing and other things is just simpler, and so it doesn't require as much work, and so you can put more money into actual program benefits. And so overall, it just tends to work better, and I think it shows people more respect. It sort of respects them as an equal citizen. And I think that's a really important aspect of it as well. So in general, you want to try to organize your income support programs as universalist programs, and social insurance makes it easy to do that, whereas social assistance type programs kind of inevitably fall into this sort of residualist approach. All right, so that's social insurance and social assistance, and now I just want to compare social insurance and UBI or types of guaranteed income. And the reason I'm going to focus on UBI as the subtype of guaranteed income is because some types of guaranteed income might not provide much income support, but if that's the case, then you might still need social insurance programs or social assistance programs. So there's not really a comparison; it would be sort of a both and. Whereas with UBI, the real question is, can we use a UBI to replace social insurance or social assistance? And so we're sort of comparing to think how that might work. So fundamentally, both a sort of what I'll call a comprehensive system of social insurance, like the one I talked about, the one that has good programs for the 6 key risks that I mentioned, and UBI kind of share the same goals. You're trying to get income to people who would otherwise be without income. UBI tries to do this by using a single program for everyone. Social insurance does this by using a set of program for different roles. And most of the main differences then between these two approaches stem from that sort of difference in how the programs are arranged. So I want to start off by saying, well, what are some potential advantages of UBI? So one potential advantage is even further administrative simplicity. So I just said that social insurance tends to be administratively simpler than social assistance. Well, UBI can go even a step beyond that. With social insurance, you might still have to show that you're over age 65 for Medicare, for example, or that you're below age 18 to get a child benefit, or that you're unemployed to get unemployment insurance. UBI gets rid of all that. It just says, hey, are you a member of this community? Do you reside in a given area? Or depending on how you set up the program, are you a citizen of a given area, or however you want to set it up? Once you establish that, then you're good. You don't need to do anything else. And so administratively, it might be very simple to do this. And this could mean that you reach more people, so you have very high uptake rates. Might mean that you have low overhead, so you can put more of the money into benefit. And so that's a potential advantage of UBI. However, in practice, social insurance actually does tend to reach most people with very low overhead. So OASI is probably the clearest example here. Virtually all people who are potentially eligible, who have enough qualifying working quarters, or are a survivor of someone who does reach, get their OSI checks. It's over 98%. Overhead is extremely low. Overhead is like, a fraction of a percentage point of the total amount of benefits that are paid out. And so so I do think UBI is likely to be simpler and likely to reach more people, but you're probably running into some ceiling effects such that, social insurance already has pretty low overhead. And so there may just not be a lot of room for improvement here, but potentially there's an advantage to UBI in that. However, there can be some disadvantages with UBI. And so the main thing that people will often bring up when talking about UBI in terms of disadvantages is the cost of it. Now, we have to unpack what is meant by costs when doing this. So there are really kind of two kinds of costs, what you might call fiscal costs and what you might call macroeconomic costs. So fiscal costs relate to what appears on a government budget. Macroeconomic costs relate to how people react to that government spending. So fiscal costs, if you're looking at fiscal costs, UBI will cost about twice as much as social insurance because it covers twice as many people. If we said social insurance would cover about 50% of the people in the US, the people who are not working for a covered reason, well, UBI will cover 100% of people in the US by definition. So it's about twice as much. However, fiscal costs aren't really all that important. They are for political messaging, but in terms of economic substance, they don't matter too much because they're not really committing real resources to do anything. They're just changing ownership rights. And so to illustrate this, imagine something that is really committing resources to a purpose. So if we spend, a lot of resources on healthcare, those are resources that can't go to schools. That it gets used up on healthcare and can't go to schools. But if we just are transferring money from one individual to another individual, we're not actually using up that money. We're just changing who gets to choose how to use that money, who owns that money, you could say. And so you're not really committing resources to any particular purpose. So the fiscal costs aren't so important. but the macroeconomic costs might be important. And within these, you can also subdivide them into two types, something that economists call an income effect and something called a substitution effect. So an income effect is the idea that if people don't need to work as much to have the same level of income, they might choose leisure over labor. So if your goal is to have $100,000 a year in income, and right now that comes all through your job, but now you get a UBI that pays out $10,000 a year, you might only work enough to get $90,000 and then top off with the UBI. That's the idea. This theoretically could lead to less labor supply and thus lower the overall national income, the overall amount that we make to distribute to other people. And in general, if this does happen, it would probably affect UBI more than social insurance because social insurance is mostly going to people who wouldn't be able to engage in paid labor in the absence of the program. That's the whole purpose of it. And so probably if there is an income effect, it would mostly affect UBI. However, empirically, and this is a good overview of some of these issues, the paper that I put to the side there, these tend to be pretty small. This is something that gets talked about a lot by conservative commentators and things like that. But in practice, it doesn't seem like people really adjust their labor force participation that much based on income support programs. So it's something to be aware of, but empirically tends to be pretty small. The other type of cost is what's called a substitution effect. And so this is not related to the amount of benefits you receive, but the taxes that some people might have to pay to finance a UBI program. And so the idea here is that if people's taxes increase, then they say, well, it's not worth it to me to work that much. So if I was previously able to work 40 hours a week and earn $100,000 take home, but then my taxes went up. And so now working 40 hours a week only lets me take home $90,000 because some extra gets taxed away to go to finance a UBI program. Then maybe I just don't work as much. And so this could, decrease the national income in the same way. This, of course, would depend on the specifics of how this is financed. Also, it's a matter of debate as to how large this effect is. Some people really emphasize that this is going to, tank the economy and kill off gross domestic product and the national income and that kind of thing. Other people say, probably not so much. My read of the evidence is that there's probably at most a moderate impact and more likely a small impact of these kinds of effects, but it's a consideration that people talk about. And again, because a UBI will generally have twice the amount that needs to be financed as a comprehensive set of social insurance programs, this might affect UBI more than social insurance programs. And so overall, when comparing these, I think the macroeconomic costs of UBI are likely to be higher than social insurance, but there still might not be all that big of a difference, and it may offer some administrative advantages. So I overall am slightly in favor of social insurance for the reasons here, but I think a UBI would be very doable as well and would provide a lot of the same benefits in some ways. And so, anyway, so I have a slight preference for social insurance, but UBI would be totally fine and is normally justified too. I think it would be politically harder to pull off, though. Last thing I'm going to mention before the conclusions, because I know we're running out of time here, is this question of how are you going to pay for all this? The book goes into this in great detail. I won't belabor it here. This is an area that I really felt like I needed to learn a lot myself to do. This is the question that always comes up when you start talking about income support programs, and so I wanted to be able to have good answers to it. And so there are a couple chapters in the book that go into public finance, and I think hopefully a useful level of detail. And so if you're interested in this question, I will refer you there. Fundamentally, though, you're going to need a combination of income taxes and in particular, progressive income tax, meaning that the tax rates increase as factor income increases. And then some trade-off between a consumption tax, so things like a sales tax and a VAT, or a wealth tax, so a tax on assets that people hold. When wealth is unevenly distributed, as it is in the US right now, it may make sense to have more of your financing be from a wealth tax. As wealth gets more evenly distributed, as exists in some societies in the world, then it doesn't make as much sense to tax that because it's, again, relatively more equal. And so you may want to shift to having more of a consumption tax. And so many European countries have a lot of their financing come from a VAT, a value added tax, which type of sales tax or consumption tax, because their income levels are more equal, or sorry, their wealth levels are more equal than the U.S. But fundamentally, the income tax should sort of be the backbone of the tax system with some trade-offs between consumption and wealth taxes. And again, go into more detail in that in the book. And then finally, just to acknowledge, I'm not going to talk about it at all here, but I've been talking about social insurance because I think the U.S. system is relatively weak. This again is for people who are not engaging in paid labor. That's half the population, but the other half of the population is engaging in paid labor, and so that's obviously an important part of the overall picture of improving population health here as well. And so fundamentally, your goal of factor income policy for people who are engaged in paid labor should be to increase worker power and rebalance the power between employers and employees. So it's just sort of the deck is stacked in favor of employers right now. You might do this through things like collective bargaining arrangements, unionization, sectoral bargaining, making that easier than happens in the U.S. We have relatively weak union laws, and it seems like even the NLRB, the foundation of the union system in the U.S., is sort of under fire right now. And then you also might do it through things like regulation, like minimum wage laws or anti-discrimination and other workforce protection. So won't talk about this in this talk, but there's more on this topic in the book as well. So just to wrap up, so fundamentally, transfer income programs are necessary to ensure the vital conditions. People need income to get products necessary for health. And so if you don't have transfer income programs because half of your population is not engaging in paid labor, there are going to be a lot of people who run into problems. Social insurance offers big advantages as a mechanism for income support. There are a couple different ways to do income support, but I think social insurance should be the primary one. And so what this means overall is that social insurance is a key part of an overall policy system that can advance population health and health equity. And then I'll leave here just my sort of four-line summary of what we need overall. So basically, every non-worker needs an income program. That was the subject of this talk. Other topics that you go into in the book are or that I go into are done here. But fundamentally, this is sort of the nutshell argument about how to use social policy to improve population health. I haven't printed up any yard signs yet, but maybe I will at some point. All right, thanks a lot. Would be happy to take questions from y'all, and if you read the book, I would be happy to get any feedback about it. Hopefully, it's useful. And I'll stop there.
I want to thank you, Seth, for a really fantastic and insightful presentation. You've given us a lot to think about. And unfortunately, we're also running a little bit short on time for questions. We're going to just have time
Okay,
for
no
one
worries.
question. Let's see, we have one question from Paula Braveman, which I realize does not get, we have 4 minutes. It's not going to be enough for an answer. Just to get us all thinking, Paula asked, what do you think accounts for the profound differences between the US and other affluent countries on the provision of social insurance?
Yeah,
I realize that's not a short
not
question.
a short question. No, I mean, so there are different theories that historians have kind of uh, posited about this, and I don't claim to be an expert in this area. People certainly point to the sort of history and ongoing presence of racism in the U.S. And sort of the use of sort of racialized demonization of populations to mobilize against public policy. Another angle, which I think is actually compatible with this, is that relative to other countries in the 30s and 40s, and particularly after World War II, U.S. capital was left mostly intact. So a lot of Europe was like pretty substantially devastated. A lot of industrial capacity was lost in World War II. And so when the sort of golden age of welfare state building was happening in Europe, it was done through labor parties and sort of social democratic parties that probably faced less opposition from business owners and those kind of things. Whereas in the U.S., capital was left relatively unscathed by World War II, and in fact may have even been bolstered by World War II. And so, even though there was the New Deal coalition by the Truman administration on, you really did not have a sort of labor type party in the U.S. anymore, and you had much more organized and powerful sort of capital interests. And so, effectively, during the time period that many other countries were building out their welfare state, the U.S. was sort of regressing and to some extent even backing away from what other people are doing. We sort of point to the Johnson Great Society legislation that established Medicaid and ultimately SNAP. and at that time AFDC, and which later became TAMP, and those were important expansions compared to what happened before, and again are better than nothing. But those were very residualist, means tested programs, and represented a real shift in public policy making compared with, say, the Social Security programs that came as part of the New Deal from 1935, and then significantly reformed in the late 40s. And so, some historians will attribute that to the relative political strength of capital during that time period, and then, just good old-fashioned racism probably has to be in the conversation as well.
I want to thank you for a really uh, intriguing presentation today. You've given us all a lot to think of, particularly as we head out to take care of our patients this afternoon. So, thank you for joining us, Seth, and thank you for our audience for joining us as well. We look forward to seeing everyone soon at future Grand Rounds. Much appreciate everybody. Thanks. Bye bye. Have a
Thanks,
good
Phil.
afternoon.
Appreciate it.